The GPs voted for GPC to quit working with the GP Forward View plan unless money starts to come through. How would you go about doing that exactly?
Well, I think it's very clear that practices and GPs around the country are not yet seeing the evidence of the GP Forward View delivering for them and for their patients. And this is something that we've been repeatedly concerned about over the last year. We do need to see evidence of practices seeing the benefits of the promised funding and all of the various different schemes that the GP Forward View contains. It is very complex. There's far too many schemes and too many small pots of not recurrent money that is leading to lots of frustration, lots of bureaucracy, lots of hard work, but very little actually delivered. What we need is much of that funding consolidated, but above all, we need recurrent funding, because without recurrent funding, we can't make an expanded workforce sustainable. We need recurrent funding for more pharmacists, more therapists, more nurses, more GPs, and at the moment, the Forward View doesn't promise that or commit to that.
How would GPC secure that funding?
Well, we have to engage with NHS England, with the government, and we have to convince them that it's in their interests to provide the recurrent resources, because without that, we won't have a sustainable general practice. We won't be able to deliver and meet the needs of our growing numbers of patients who have complex problems within the community. So we genuinely do need to expand the workforce. The government are committed to an expansion of the number of GPs and pharmacists and therapists. What they haven't done is provide the recurrent resources, and that's what they must do.
Following the motion on the online consultations, how will the GPC oppose online consultations in negotiations with NHS England?
Well, I think we need to be clear that GPs are not opposed to new technology. They've often been at the forefront of the developments around new technology, want to ensure that new ways of working meet the needs of their patients, that we have a diversity of arrangements so that GPs use telephone consultations, they can use video consultations, and they can use face-to-face consultations where it's appropriate. But what we mustn't do is create a divide between some patients being able to access our services in one way that is inhibiting other patients from accessing our services. We also need to recognise that increasingly, without the necessary extra funding and capacity, these just add extra burden to GPs who are already struggling with the service to maintain the services that they have to at the moment. So we can't add extra work. We have to take some work away. We have to make it easier for patients to see us, but not add to the additional burden that many GPs worry about.
It was very nearly conference policy for GPC to support practices to go private. This discussion has now been opened. What will this mean going forward for general practice?
Well, I think we need to be clear that the motion didn't propose that practices would go private. It was about enabling practices to be able to provide a greater range of services to their patients, and in many cases to provide services that are not available on the NHS in their area. There are restrictions placed on GPs to meet and prevent them from meeting the needs of their patients when patients want additional services from their GP. It's something that GPC is committed to try and resolve. We've been encouraging government to allow GPs to provide those services that are not commissioned on the NHS to their patients. And it seems wholly reasonable that a practice could, for instance, give a flu jab to a patient who wants that, who's not eligible for a flu jab, but for whom they're prepared to pay for that, when the pharmacist, maybe in the same building, can provide that service to a patient. We need to ensure that GPs and practices are able to provide services that patients want when they are not commissioned by the NHS.
Are you expecting more motions in the same vein to arise in the future?
Well, I think we would hope that the government listened to the concerns that GPs and LMCs have been consistently raising over the last few years. It seems self-evident that practices' concerns should be listened to, but at the moment the government is very worried about the perception of this being a privatisation of the NHS. That's not what this is about, and it's not what GPs are calling for. GPs want to be able to provide a fuller range of services to their patients, and they don't want to undermine the NHS service by doing so.
How can general practice guarantee patient safety if patient lists are closed, even to local patients trying to register to practice?
Well, the first and foremost thing that a practice and a GP must do is ensure that they are providing safe services to their patients. And they also need to ensure that they keep their doctors, nurses and others in the practice safe and reduce the risk of burnout by overwork. We're very aware that increasingly practices are struggling to be able to meet the needs of their patients. And one way to provide a safe service is to limit the number of patients registered at that practice. The real problem is then where do those patients in an area go to if the practice has been closed. But that's a problem that the CCG must face up to. They must commission additional capacity, additional services so that patients can get access to general practice. But they also must support to a far greater extent those practices that are struggling, those practices that have sent out an alert saying that we can't deliver any further services to any more patients without undermining the quality and the safety of services that we're providing to our existing patients. So the responsibility is on the CCG to step up their game and provide additional support to practices in those situations.
The government has said that they can't guarantee indemnity. The indemnity scheme will bring GP costs down. Is your expectation that it will cover indemnity costs in full?
Well, we need to have a scheme that's fair and that it's similar to the scheme that pertains in hospitals. Consultants and junior doctors working in a hospital don't have the same worry that GPs have. They don't have the same tax effectively, sort of which GPs have to bear. We know that GPs pay on average £8,000 a year for their indemnity. That means that full-time GPs or GPs working in out of hours are paying far more than that, maybe 10, 12, 15,000 pounds maybe in indemnity, and that's not sustainable. And you wouldn't see a consultant or a junior doctor paying that amount of money simply to be a doctor in the hospital. So we need a level playing field. We need to ensure that wherever you work within the NHS, you're covered by a state scheme and you don't have to worry about the burden of indemnity.
So your expectation is that it would cover GPs in full?
Yes, the expectation is that the scheme that the government have now committed to must cover GPs, whether they be partners, salaried GPs or locum GPs. Any GP on the NHS performers list providing NHS services, whether that be in hours or out of hours, should be covered by an indemnity arrangement that the government must